So stem cell transplant continues to fall more and more out of favor as a therapy for relapsed large B-cell lymphoma patients, obviously with CAR T cells and that therapy being approved in the second line, and now bispecific antibody therapies that are approved in the third line and available in the United States in the second line. And I do think there might still be some patients who could be candidates for stem cell transplant, but it might be hard to identify them. Those patients may have more favorable molecular risk features. We do know that patients who relapse late, after a year of their initial, the completion of their initial therapy, may be good candidates as well. So I think there's a small proportion of patients who still may benefit from stem cell transplant over these newer therapies. And we do know, however, that stem cell transplant provides a very, very long progression-free survival and cure, and potentially a higher rate than some of these other therapies. So I do think it's worth continuing to investigate which patients may respond well to stem cell transplant, because for those who do well with it, it's a very, very effective therapy.